The structures of the lower respiratory tract. The first one is the larynx. The larynx is going to be where the vocal cords are found. So this is where your voice comes from. Next, inferior to the larynx is the trachea. You have one trachea, and it's going to have hyaline cartilage. And we have hyaline cartilage rings here that are finished off with a little peck of smooth muscle. Okay, the trachea is also going to be lined with pseudostratified ciliated columnar epithelium. That is so long. It's lined with pseudostratified ciliated columnar epithelium, and you also have goblet cells there. The purpose of the goblet cells is that they're going to secrete mucus, and the cilia are going to beat back and forth, and they're going to raise the mucus up the trachea so that it goes into the pharynx region so that it can be swallowed to go into the stomach. So we'll kind of get to that whenever. That's actually all we have to say about it. We don't have to get to it. Okay, the next structure of the trachea, or the trachea, is actually going to lead to the bronchi. The bronchi, you have two primary bronchi. These are going to lead to the lungs, lead to each lung. Okay, these primary bronchi, let's say here, this is the trachea, and it's going to branch something like this right here. Okay, so these right here are the primary bronchi. We'll switch colors and we'll talk about the secondary bronchi. Okay, secondary bronchi are going to branch off of the primary bronchi. So here are your red secondary bronchi. These secondary bronchi are going to lead to the lobes. Leads to each lobe. The right lung, this is the right side, it has 3 lobes. And the left is going to have 2 lobes. Remember too that the heart is going to be sitting right about here. Here's the sternum here. So 2/3 of the heart sits to the left of the sternum, and that's the reason that the left lung is going to be smaller. Okay, the secondary bronchi are going to divide into tertiary bronchi. The tertiary bronchi are going to take air, so it leads to each bronchopulmonary segment. Okay, the tertiary bronchi are then going to branch into smaller structures called bronchioles. Okay, and the bronchioles are going to take the air to the alveoli. Okay, so let's look at how to do that. Okay, let's erase some of this so we can look at the structures of. We want to write those structures again and then talk about how they're different. Okay, so let's write trachea, primary bronchi, secondary bronchi. So trachea, primary bronchi, secondary bronchi, tertiary bronchi, bronchioles, and alveoli here. So here let's look at the trachea. We said that we were going to have smooth muscle and cartilage. So here we're going to write our little cartilage here. We have less cartilage in the primary bronchi. The secondary bronchi has even less cartilage. The tertiary bronchi has even less. The bronchioles have very little cartilage, and the alveoli have none at all. Okay, so this right here is going to be simple squamous. Remember that you're going to have exchange in the alveoli, so it has to be simple squamous tissue. Okay, so then let's go back up here and say this is our cartilage. This is our smooth muscle. This is our smooth muscle. Notice that the percentage of smooth muscle gets higher as you go down the bronchopulmonary tree. So we're going to have a As we go this direction, as we go from our large structure to our smaller structures, it will decrease in cartilage and it will increase in smooth muscle.